You're listening to If Only I Were Wiser podcast, where Raina Wilson brings together wisdom and raw life stories to provide encouragement and truth. So many times it's easy to become discouraged in your own pursuit of health because your story or circumstances look drastically different from your favorite influencer or even the expectations you had for yourself. If that is you, welcome. This space is for you to learn, breathe, and maybe just listen and see what wellness could look like for you. Hey friends, welcome back to the If Only I Were Wiser podcast. On today's episode, we're covering all things pelvic floor health from a good friend of mine, Dr. Rachel Fritz. Rachel is originally from Little Rock, Arkansas, and grew up playing soccer, softball, which really developed her passion for rehab and physical therapy. She later received her Bachelor of Science in Kinesiology from Texas Christian University, another fellow frog, and her Doctorate of Physical Therapy from Texas Tech University Health Sciences Center. As she progressed through her curriculum, Rachel came to realize the importance of pelvic floor rehab and the impact dysfunction can have on day-to-day life. So that's all today's conversation. Whether you're pregnant or postpartum or have never heard of what your pelvic floor is, then this episode's for you. Let's dive in. Rachel, Dr. Rachel Fritz, man. I think that's so just crazy.
Hello.
Dr. Rachel Fritz. How does that feel?
It's wild, man. I think the first time that it really set in wasn't until I was like walking across the stage and our our interim president of the Health Sciences Center like shook my hand and said, "Congratulations, Dr. Fritz." And I was like, "Oh, that's me." So yeah, it was wild. It was wild.
That's so funny. Yeah, well, thank you so much for joining us on the If Only I Were Wiser podcast.
Absolutely.
I'm just so excited for the variety of stuff that we're going to cover today. I honestly just want to start with a little bit about you and how did you get to become a doctor? Like, that's crazy. School, all the things.
Yep. So I went to TCU for my undergraduate degree, go Frogs, and it's where I met the lovely Miss Raina. And so I got my bachelor's in kinesiology and then decided to go on to get my doctorate in physical therapy. And I graduated from Texas Tech University Health Sciences Center. And yeah, it was just a crazy, crazy time and found the pathway and it just kind of all these doors opened up for me. So it was awesome.
Yeah. So what did school look like? Because when I think like doctorate, I'm thinking you don't come out till you're like 50.
No. It felt that way. It definitely felt that way. Yeah, I was let's see, it was 4 years for the undergrad degree and then another 3 for the doctorate. And so we didn't have much time off between semesters. Like we definitely didn't have a summer break. We did not have very long for Thanksgiving and Christmas. It was pretty much like, I remember we graduated and then 2 weeks later, PT school started. So it was a very, very quick, Yeah, it was a quick turnaround. So it was funny. I hadn't heard back from a couple of schools and it was kind of getting close to the time where, I kind of needed to start making plans and making decisions for the summer. And so I remember I was on my phone with my dad and we were talking, he was just like, okay, well, like if you don't get in anywhere, if you don't hear from anywhere, like we'll just plan on moving you home. We're like making all these plans for, if I didn't get in. And I was flying out for spring break, I think like the next day or two. And he was, and so kind of wrapped up that conversation. He was like, okay, it's like, when's your flight? Where are you going? All this stuff. And so I like pull up my email. I'm like, let me double check like my flight time and everything like that. And as I'm pulling up the email, I get a new email in my inbox that I had been accepted into Tech's PT program. And so I just started bawling and I'm just like on the phone with my dad. I was like, scratch everything. I was like, we need a whole new plan.
Wow.
So yeah, it was a quick turnaround to graduate, move out of Fort Worth over to Lubbock, get a place there and just kind of hit the ground running with PT school. So.
Oh, how fun. Dang. So are you in Lubbock now? Like, is that where your clinic is?
Yeah, so I'm in Amarillo, Texas. So
Okay.
Tech has a couple different campuses for their PT school. They have the main one in Lubbock where we all went for the first semester. And then they have two other satellite campuses. One is in Odessa and then the other one is up here in Amarillo. So I was here in Amarillo for the majority of the curriculum and
Okay.
then just found my amazing job afterwards and just kind of stayed in the area.
Awesome. So are you at like a PT clinic? Like
Mhm.
do you work alongside like all, when I think of PT, I'm like the people that are going in to work on like the geriatric patients for knee pain?
Yeah, for sure, for sure. Yeah, so we treat at our clinic, we definitely treat everything, knee replacements, shoulder pain, ACL
Gotcha.
repairs. I mean, we got a couple, got some good young athletes in there right now doing all sorts of crazy stuff. But so yeah, so we really do treat a very, very wide range of conditions. So it's really cool just to kind of see a little bit of everything.
Right. But you specialize in pelvic floor health.
Yes. Yes, I do.
How did you even get there?
So it really wasn't until I was in like my PT school, doctorate level gross anatomy classes that I really even heard of the pelvic floor, that it really ever kind
Mm-hmm.
of got a name for me. And at that point, when we were kind of going over it in our gross anatomy classes, and they just kind of mentioned like, oh, hey, by the way, like there's a whole kind of specialty field in this area in pelvic health that you can go into as a physical therapist. And then it was like, okay, moving on. So this is this, and then we just kind of brushed over it. And I was kind of like, okay, like that's pretty interesting. Like that sounds really cool. Didn't really give much thought to it. And kind of the more that we kind of started talking about as we kind of got into the orthopedic side of things and just kind of like, okay, these are going to be the things that you treat in the clinic. I was like, well, it sounds like the pelvic floor could really be involved in some of this or at least indicated in a lot of these conditions. And, the more research that I did kind of on my own, I was like, oh, this is
Mm-hmm.
needed. This is huge. And so I ended up, I kind of talked to some of my professors a little bit. And what really kind of did it for me was we went to the Texas Physical Therapy Association. They have a conference every single year. And so a bunch of us went as first year, little baby PT baby students, and we're like, let's go, like, we'll go to all these talks, all these lectures, and we'll figure out, all the
Yeah.
things. And we went to a 4-hour talk on pelvic floor health, and it was just like after that I was like, done. That's it, that's
Wow.
decided. And a bunch of my friends and I were kind of walking out, and some of them were just kind of like, no, absolutely not. I will not be doing this. Like, not for me. And I was like, what are you talking about? That was the best 4 hours of my life. Like, that was the coolest thing ever. And they all just kind of looked at me and they were like, yes, like that fits you. That fits your personality. You go on. And so they have been just super, super supportive and just able
Mm-hmm.
to, and kind of talked to some of my professors about it. I was like, is there anybody even, I was like, we're in Amarillo, Texas. Like, come on, is there anybody here who even does this? And they were like, oh, yes, you need to go talk to this
Right.
person. Like we'll get you in touch with her. And so her name is Alita, and I ended up being able to go and shadow with her a handful of times just kind of throughout my curriculum. If I had a day off or if we got out of class or, whatever it was, I'd, send her a text, be like, hey, what are you doing? Can I come hang out? And, just to kind of get more exposure to it
Mm-hmm.
and
Yeah.
everything. And lo and behold, she is now my boss.
Yeah.
So I ended up working with her, and it was just kind of like a bit crazy full circle moment.
Wow.
She was just really excited that I had shown so much interest in it. And so by the time that I had gotten ready to graduate, and a lot of PT clinics will do this, they'll send like their job postings to our professors and, ask them to send it out to like the graduating class. And
Mm-hmm.
so she sent hers out. I had like 6 people text me and be like, did you see that email? Alita is hiring a pelvic floor therapist. Like, are you responding? One of my professors called me and he is like, I'll go over your cover letter with you if you want. And just like, it was just like, it was a no-brainer. It was a no-brainer. So
Wow. How sweet. That's just cool to see like God's hand in the midst of that, you know?
It was, yeah. And I almost took a job up in Wyoming because I did a clinical rotation up there for Pelvic Health, and they offered me a job afterwards. And I just remember praying. I was like, Lord, I will go to Wyoming if you really want me to. I will go.
Right. If you really wink, wink, want me to.
Literally, I was like, but I need you to close every other door to me. Like, make this my only option. And then, sure enough, this job kind of came along, and I was like, oh, okay, got it. I'm going.
Right.
Figured it out. So
That's awesome. Can you share a little bit about like you outside of Dr. Rachel, and then we'll dive into Dr. Rachel?
yes, absolutely. So I grew up playing sports. I mean, I played soccer, I think probably my whole entire life,
Mm-hmm.
as far back as I can remember, and ended up needing PT myself for some knee pain that I was having, and which is crazy, crazy common with female
Mm-hmm.
athletes. And I think I went to my PT, I think once, and he just kind of like did his assessment, gave me my exercises at home. And he was like, I honestly don't think that I'm going to need to see you again. Like, if you have a problem, if it still hurts after kind of run the course of these exercises,
Mm-hmm.
let me know and we'll get you back in here. But I think I asked him probably 8 million questions. I'm like, okay, so how did you become a physical therapist? What do I need to do? Can I come in and shadow you? Like, do you need an intern? And he's like, you're 14 in middle school. Like, no, you're fine. And so it was just that was kind of what got me into kind of the rehab side of things, and just love staying active. I compete in bodybuilding competitions, which is super, super fun. That is just so much fun.
Woohoo.
But yeah, if I'm not at work, I'm usually at the gym or trying to go on some random adventure. So
Yeah, so fun. I definitely want to circle back to the bodybuilding
for
towards the end,
sure.
because that is just such an exciting conversation that a lot of people don't get to have. So we
Yeah,
will
for
cover it.
sure. For sure.
But let's dive into all things pelvic floor health. I think it's so funny that now I feel encouraged because I'm not the only one that didn't know this was a part of my body.
Oh yeah. Oh
Right?
yeah.
So can you kind of give the basics to, like, do men have pelvic floors? Like, is this just a female thing? Like,
Yeah.
the basics to us laymen in pelvic floor health.
Yeah, absolutely. So the pelvic floor refers to a group of muscles. So it's kind of similar to like the hip flexors. You have more than one. There's a group of them that kind of do that motion, that hip flexion. And so the pelvic floor is it's 3 layers of muscle that sit literally in the floor, in the basis of the pelvis. So if you've ever kind of looked at like a skeleton model, like you have the bones and that bony pelvis, well, in the middle of that bony pelvis is that big hole. And with ladies, that's where baby's head comes out. So the pelvic floor sits basically kind of right in the center of that. And yes, it is in men, it is in women, it is in children. Everybody has a pelvic floor. Women are definitely more at a higher risk of developing pelvic floor dysfunction just because of our anatomy, just kind of how things are shaped and put in there. But also with pregnancy and postpartum, that's a lot of pressure and a lot of changes that need to happen to those pelvic floor muscles. And so, yes, women are definitely more likely to develop some sort of pelvic floor dysfunction in life. And these muscles work to control peeing, pooping, sex, and they also work really closely with the abdominal muscles, with the core muscles, and with the diaphragm as well, to help to kind of control some intra-abdominal pressure, some lumbar spine stability, that pelvic girdle stability. And so there's really a lot that they do, and not a lot of people even know about them in the first place. And so one thing that I try to do with any sort of new patient, with any new evaluation, is we spend a ton of time just talking about anatomy and function, because it's always the number one. I get 2 questions. What is the pelvic floor? And why have I been sent to a physical therapist when I leak when I sneeze? Like, what in the world is happening here? So we kind of talk about how in these muscles, they're maybe the exact same muscles that you'd find, the same muscle tissue that you'd find in your hip flexors or your hamstrings or your biceps. And so we have the same voluntary control over these pelvic floor muscles, right? Doing Kegel exercises. That's kind of the bicep curl of the pelvic floor. but they have a lot of involuntary function as well. And they don't move the joints, all right? When we contract, when we do a Kegel, we don't see anything happen. At least you shouldn't if you're doing it right. And we don't really see anything happen. And so that mind to muscle connection, that motor programming tends to get lost a little bit. And it's harder to establish, more so than with a muscle that you would be able to see and kind of watch that function there.
Which we can dive into later, but as I went through pelvic floor therapy, like that was just so fascinating, because like you said, I couldn't test, in an outward form to see how my pelvic floor was doing. So we had to do like all internal examinations.
Yep.
So I'm just so thankful for you, because some people approach this as like a really grody conversation.
Yeah.
But like kind of researched myself, like the female anatomy is beautiful. And the fact that like, as we normalize this conversation, like my husband and I were talking about this the other day, like my son should know about the female anatomy. Like my son should know about mama's periods, or, hey, like when mama has a baby, like this is how her body changes and we have to be careful about this, and this,
Yeah.
pregnancy, postpartum, whatever. And it shouldn't be like a taboo conversation. That's a side note.
Absolutely. Yeah, absolutely. And I think that is definitely one thing that some of my patients struggle with, and it's definitely generational. I mean, I think our generation and some of my younger patients are like all in. Right. They're like, yes, like show me everything. Like I want to talk about it. And with some of my older patients, it's a little bit harder to kind of get them to talk about these things. And just because, I mean, it's a generational thing. Like they didn't talk about it at all. That was like, nope, you don't talk about periods. You don't talk about peeing. You definitely don't talk about sex outside of your marriage. And so it's just kind of one of those things where not only does that make the patient themselves feel maybe a little bit isolated and alone, and, maybe there isn't anything that we can do about it. Well, I'm not supposed to talk about it, so it doesn't matter. But it absolutely does matter. And, there's treatment for it. There's treatment for these pelvic floor dysfunctions that I have had so many patients tell me, like, I wish I'd known about this sooner. Like, why is nobody talking about this? And I was like, because nobody talks about their vaginas anyway. So like, that's kind of why. But, but yeah, I think that we are definitely kind of shifting, not only in just kind of society, but in medical care as well. Just being able to really open that door and just have that conversation, because again, there is treatment. And so these people, you don't have to suffer in silence when it comes to these things.
For sure. Can you kind of cover, when I first heard about pelvic floor health, it was because of pregnancy and postpartum. But I think like it's healthy to know about, when treatment is needed in all those stages. So what would you say to someone, you want a healthy sex life, healthy sex life, you want to be safe, and then pregnancy and postpartum, and kind of some of those stages?
Yeah, absolutely. So like I said, the pelvic floor mainly functions with peeing, pooping, and sex. Those are the main things. And so if you have any problems doing any of those things, pelvic floor is involved, and you should definitely go see a pelvic floor therapist. So with urinary function, that can look like leakage or incontinence, with laughing, coughing, sneezing, running, jumping, or with that high sensation of urgency, like when you feel like you really, really, really got to go and there's no stopping it. If you're feeling like you're not emptying all the way, or, feeling like you're going, feeling like you have to go like every 5-10 minutes, but that's not related to a UTI, those kinds of things. And with bowel function, same thing. If you have any incontinence of stool, of bowel material, that is absolutely something that can be treated. We're going to want to figure out why, like what the cause is, but then get into the muscle function and just kind of that muscular control of those sphincters. And, and also constipation. I see constipation so much. It kind of blows my mind. Like, the more that I kind of try to dive into that, the more my patients are like, oh, well, yeah, like I've always been constipated. And I'm like, what do you mean? Like, what? We're not just going to speed past that. Like, that doesn't mean anything. Like, no, we got to talk about that.
So how does constipation tie into that?
Yeah, so depending on the muscular function, so these muscles, like I said, they control pooping, whether it's letting it in or letting it out or
Mm-hmm.
keeping it in. And so with constipation, sometimes what I see is people bearing down a lot. They're straining and really, really pushing. We never want to strain on the toilet
Mm,
ever. Voiding, whether it's number one or number two, should be completely passive. You should be able to just sit there, play on your phone and not think about anything. And so sometimes it can be positioning. People that have really high toilets, what actually changes that pelvic position, which can put tension on some pelvic floor muscles and actually inhibit the passage of stool, depending on where everything is. So the brand Squatty Potty, their little commercial, 100% true, 100% true. I
mm-hmm.
recommend Squatty Potties to
Yeah.
literally everybody. So whether or not they have constipation.
We actually bought one for postpartum because I just remember hearing about the first postpartum poop and I was like so scared.
Yes.
And I had like,
Yep.
students, because I worked with high school and middle school students at the time, would come over to the house for dinner and they're like, Miss Raina,
Yeah.
why is there a stool next to your toilet? And I was like, well, guys, it's to help your pelvic floor. Like it shouldn't hurt to poop. So we support the squatty potties.
Yes, exactly. No, like I said, literally 100%. Everybody should have one. Everybody should have one. But yeah, and so if those muscles, if they are, like I said, they work the same way that any other muscle does. So they can be weak, but they can also be tight. And so if there's any sort of tightness or inability to relax those muscles as you're trying to poop, nothing's going to come out. Nothing's going to come out. So
Mm-hmm.
and then with sexual dysfunction, any pain with sex is not normal. It is not something that you have to live with. It doesn't matter what position you're in. It doesn't matter
Yeah.
how much lube you're using. Under any circumstances, it should not be painful. And I think that's kind of one thing that I had to kind of have had to discuss with a lot of my patients. They're like, well, it only hurts in, if I start asking like any pain with sex, and they're like, oh, well, I mean, only in that position. It's like, it doesn't matter. Like, no. Yes, it does.
No.
We're going to address that. Any pain with sex, whether that's penetration or any pain with climax, even any difficulty achieving climax in the first place. And for men, erectile dysfunction. You can treat erectile dysfunction with Pelvic Health, with Pelvic Floor Physical Therapy. So it is a
Wow.
muscle that is responsible for achieving and maintaining that erection. And I'd say that we mainly see this in kind of post-surgical considerations with men. Again, just women are just more likely to have it just because of our anatomy.
Right.
And having babies. But with men, their anatomy is a little bit different. It's a little bit more secure in there. And they don't quite have as much trauma to the pelvic floor kind of throughout the lifespan that women do. And so it's not super common. So like I said, it's mainly post-op, usually a prostatectomy of some kind that can cause some changes in bladder, bowel, and sexual function in men. So those are kind of the big things. Like I said, if you have any trouble peeing, pooping, or during sex, that is 100% an indication for pelvic floor physical therapy. And it may well be that those muscles are functioning fine, and maybe it is something with the bladder itself. Maybe it is something with the bowel itself. If it's Crohn's disease or diverticulitis, something a little bit more medically complex.
Right.
But we can be used as a tool just to kind of help screen that muscular function. So. We've gotten that a lot. We have a midwife here in Amarillo, and she sends every single one of her patients postpartum, every single one, like does not matter. She's like, yeah, it's yes. And it's awesome. So we can definitely be used just as a screening tool, just like, okay, you had this surgery or you're curious if something's going on. Let's check. Let's talk about it. Let's see what's going on. If we don't find anything, great. It means that you're good to go. Or maybe it means that there's something else that's relating to your symptoms. Or you know what? Yeah. Pelvic floor is definitely involved. Let's treat that, and then we'll go from there.
Absolutely. Wow. So would you say that some of these symptoms change throughout pregnancy and postpartum, or are they all kind of the signals that you're looking for in treating any of these clients?
Yeah, so those are definitely things that can happen to anybody at any time, pre-pregnancy, during pregnancy, and postpartum. I'd say that the more common things that we see during pregnancy and postpartum is pelvic girdle pain. That's kind of the big one.
Okay.
We have this lovely hormone called relaxin that makes its way through the system whenever a woman is pregnant, and it helps to expand the pelvis to allow baby to pass through that birth canal no problem, which is great for baby,
Yeah,
but
for
can be
baby,
super
not for mama.
uncomfortable. Yeah, not for mom, not for mom. Can be super painful and uncomfortable. Work a lot on kind of addressing that muscular function. Even during pregnancy, we are completely safe to do internal exams during pregnancy and kind of testing that muscular function. And then post-pregnancy as well, making sure those muscles are firing appropriately. And if there is any of that tightness, any sort of overactivity in those muscles, we can calm that down.
Gotcha.
And get those muscles back to that resting state, or strengthen as appropriate with, some core integration and some more functional movement. So that's probably the biggest thing that I see pregnancy and postpartum. But again, that can happen to anybody at any time. A lot of postpartum considerations are, okay, well, when can I start exercising again? When can I start running again? And so making sure that we get the proper activation in the right muscles at the right time is definitely huge.
Yeah. So let's dive into postpartum. I think you and I had this conversation.
Yeah.
And we'll start with this. And it's probably a loaded question. But what do you think about the 6-week checkup?
So that can be great. It can be great.
Yes.
Definitely want to have that. Sometimes that's it though. For some women, it's just, it's that 6 week. And then it's like, okay, you're good to go. Bye. And it's like, okay, hang on, wait a second. Like there's still a lot of things that are changing, a lot of things that are happening. And so that 6-week checkup can be really good for, I'd say, a quote unquote typical delivery. Well, if there were any other sort of complications during that delivery process, if there was a significant amount of tearing, or if there was, any complication, you name it, after or during that delivery process, in my mind, I'm thinking that, okay, maybe we need like an 8-week checkup too, and maybe a 10-week, or, just kind of some more, more follow-up kind of in between that. So I think a lot of people just use that as the 6 week, and it's like, okay, well, it doesn't matter what happened or what's going on. You're like, it's been 6 weeks, so you're good to go. And for some women, especially that have had a significant amount of tearing, like that's like, no, they're absolutely not good to go. And they're probably going to tear more with any sort of sexual activity because those tissues aren't healed yet. And so, like I said, I think that with certain complications, there's definitely an indication for some more follow-up care. It shouldn't just be like, well, it's been 6 weeks, so you're good. We've got to look at the person. We've got to look at the tissues. We've got to look at their symptoms too.
Yeah. And I think that's a great point, because I think I had messaged you that I went in for my 6-week appointment, and again, you can correct me on this in terms of pelvic floor health for C-section mamas. But when I went in for my appointment, he checked my scar, he mushed my belly for diastasis, and was like, okay, you're good. You can return to everything that you were doing pre-pregnancy. And I was like, okay, but can I go see a pelvic floor therapist? Because that's kind of important, just to make sure, I just need somebody else to make sure that I'm good, because I don't know if I'm good,
Yeah, for sure.
And he was like, well, you had a C-section, so the baby didn't come out of there. And I, mentally, I knew these things. I was like, but I also carried a baby for 10 plus months.
Exactly.
So regardless of delivery, I think you touched on it earlier, everyone postpartum should see a pelvic floor therapist, because even if it's just for a screening process in the midst of your healing journey, that is so necessary. I had to beg for my referral.
Oh, that breaks my heart.
Yeah, at my 6-week appointment.
That breaks my heart. And like I said, I think that we're shifting. I really do. And we've even gotten referrals just for C-section scar pain. We've gotten referrals just for that. And it really does help, because with a C-section, there are so many layers that they got to cut through to get to that baby. So many layers, and so much healing and scar tissue that builds up in that process. And the way that I kind of think of the abdomen, including the pelvic floor, is it's kind of like an unpopped soda can, right? So you got the pelvic floor at the bottom, the core muscles and the back muscles, the postural muscles, that's the sides of our soda can. And then the diaphragm is the top. And so when everything is working together perfectly in this perfect little system, it's like an unpopped soda can, right? We squeeze it, nothing happens. It goes back to normal. It does not affect the system at all. Well, when we have damage or dysfunction or a weakness or incoordination in any one of those, whether we're not breathing correctly, whether we have scar tissue damage in our core muscles, or if we have a pelvic floor dysfunction, well, that's like you pop the top, stab the side, scrunch up the bottom. Now all of a sudden you squeeze it, the entire system is affected. Everything up and down is affected by that. And so especially with C-sections, just because of how much scar tissue that they tend to create, it's almost like we've kind of just lifted the pelvic floor almost. If you can imagine, like if you stomped on a soda can, right, and it kind of scrunched a little bit. Well, like yes, the diaphragm, the top is still intact, the bottom is still intact, but we have a much shorter can now. We're losing a lot of that functional range of motion due to the restrictions of the scar tissue. And so not only are the core muscles affected, but absolutely the pelvic floor is affected. I've seen pelvic floor being affected from gallbladder removal and appendix removal. Yeah, just because of that scar tissue and the adhesions that build up in the belly, again, that's going to start to pull up on those pelvic floor muscles that sit at the base. And so, and like you said, that baby still sat on those muscles for 10 months. Like, it's not like he was just floating up all happy in your lungs. There was still that pressure, and we still see some hormone changes postpartum as well. And so one of those big ones is progesterone, and progesterone works to basically, it kind of inhibits the cycle from continuing during pregnancy, but it also acts as a muscle relaxer, and which I think is just the coolest thing ever. That is such a cool hormone to me. It acts as a muscle relaxer. And so literally as soon as that baby is out of the body, out of the birth canal, no longer inside, those progesterone levels drop immediately, like tank. Immediately. And so sometimes what we see is that with that quick withdrawal of progesterone, we see those muscles, especially in the pelvic floor, because they are so sensitive to the female hormones, they just immediately tighten up. They're like, it's that immediate withdrawal of a muscle relaxer. And they're like, why did you take away my muscle relaxer? What happened? And so then we get that kind of almost knee-jerk reaction to those muscles tightening up. And so not only do you have that, you have the fact that baby just sat on those muscles for 10 months. Now you have a scar and healing to happen. You're probably in pain.
Right.
And it creates just like this perfect storm, this perfect kind of combination for pelvic floor muscle dysfunction. And like you said, it's unfortunate that not more mothers are being referred to pelvic floor PT just because of like, oh, well, you had a C-section, so it doesn't matter. It's like, are you kidding me? It absolutely does. It absolutely does.
Yeah.
Just because the baby didn't come out the birth canal, didn't go through those muscles for an hour, like it doesn't change anything. That 1 hour in the span of 10 months, like, yeah, that's not going to make that much of a difference. They're absolutely still involved.
Yeah. And there's still trauma done to those muscles, regardless of your birth story.
Regardless. Yeah, absolutely. That's one thing that I've talked to the midwife here in town about. And kind of one thing that we just like really almost like finished each other's sentences on was just like, it doesn't matter if you were in labor for 5 minutes, you sneezed and that baby popped out. Like, that is still a trauma. That is still a significant amount of change to those pelvic floor muscles and to those tissues that happens even in that sneeze, even in that 2 minutes, is definitely still something worth looking at, something worth getting checked out.
Yeah. And I think it's important to note the fact that, or rather, let's go back and talk about, are there any other symptoms or things to take into consideration in terms of, I would say, not your typical pelvic floor symptoms? So like back pain, for example. I didn't realize that my scar tissue from my C-section, because all, like you talked about, like all those muscles work in tandem, could cause back pain. or my core or diastasis.
Mm-hmm. Yeah, absolutely. And so we do see that kind of referral pattern. And so even if it's kind of one of those things where it's like, well, I feel it in my back, or I feel it in my hip, I feel it over here. Like, what do you mean it could be coming from my pelvic floor? And so just because of where these muscles sit, again, just right at the base of the pelvis, right at just kind of the center of our body. And they work really, really closely, like I said, not only with our core muscles, but with our hip muscles as well. With the hip rotators, we have a rotator cuff of the hip, the same way we have a rotator cuff of the shoulder. We have a lot of those really, really small muscles that attach just kind of right in through the glute area, right in through the butt cheek area. We got a lot of teeny tiny muscles in there, and they are neighbors with the pelvic floor, And so a lot of times if it's more of a pelvic floor involvement, we do see that referral pattern into the hip or into the low back and into the abdomen. And I mean, I've seen it all the way down to the knees before sometimes, just because of that muscle tension and those connections.
Wow.
We also have a crazy network of nerves that are involved in the pelvic floor. This is a very sensitive area, right? Like, we need a lot of sensation down there. And so it's just this vast network of nerves down in the pelvic floor. And because of that neural network and those connections, those are some long nerves, and they innervate a lot of other things along the way too. So if that nerve is involved in any way, it can kind of send that referral pattern to some of the other areas that it innervates, some of the other areas that it talks to. And so we can see that kind of referral pattern. And I've done internal release on some patients before, and they're just like, okay, yep, that feels like my hip pain, or yep, that feels like I feel that in my back. I feel that, like, I even just kind of palpating along those muscles. They're like, yeah, I feel that in like 12 different places. So I'd say it's kind of one of those things where it's like, okay, if you hear hoofbeats in New York City, think horses, not zebras, that kind of thing, right? And so if your back hurts, there's a really good chance that it's just your back that's involved. But on the other hand, if that isn't responding to our, like, quote unquote normal physical therapy or normal interventions, and maybe you do have some of those other associated symptoms like stress incontinence, constipation, pain with sex, any sort of those other dysfunctions, there's a good chance that the pelvic floor is playing a really big role in that. And so a lot of our physical therapists, a lot of our other ortho physical therapists are really, really good at kind of recognizing that, and they'll kick them over to us, to the pelvic PTs. They'll be like, hey, been treating this person for like 4 or 6 weeks, back pain, hip pain, just not responding like I want it to, not responding like it normally would. Will you take a look? Will you see if there's anything else going on? And so we'll kind of start asking those questions and having that conversation and seeing, okay, you know what, we've tried like the typical, we've tried the quote unquote normal physical therapy. Let's see if there's anything else kind of going on through there. So
right,
it's really kind of crazy, just the network that's involved, the referral patterns that we see. So like I said, if you do have any sort of like back pain, abdominal pain, anything like that, as well as some of those other symptoms and those other kind of pelvic floor signs, there's a really good chance the pelvic floor is at play.
That's super interesting just in general. And it's, just a really cool wink at how the body is just so fascinating and so complex.
Oh my goodness. Yes. So connected. And I remember that was really one of the things that they harped on in PT school too, was just like, okay, if a patient comes in and they have shoulder pain, if you're not looking at their neck, and if you're not looking at their elbow, if you're not looking at even the thoracic spine and their ribs, you're doing them a big disservice, because of how connected everything is. And especially with the legs too, just the knee pretty much bends and straightens. That's about it. And so any other sort of rotation and compensation is going to come from the ankle and from the hip. And then we can start seeing that into the low back and into the pelvic floor as well. But I mean, just looking up and downstream of the actual, involved area, it's like, okay, well, what's going on somewhere else? Like, could this knee pain actually be coming from, a tightness in one of the hip rotators that is causing, the knee to be a little bit weird and the ankle to take a little bit more load in this area, which is then causing that compression in the knee. Like, there are so many little things that we look at and can really kind of pinpoint, okay, where is this really coming from, and what other dysfunctions in the body might be causing that. The body's really, really good at compensating. It's really, really really good at being lazy too. And so if we can find those compensatory patterns and get the right muscles working at the right time, we can really see a big change.
Yeah, I recently went to go see this woman in Dallas. She does a little bit more of a holistic approach to pelvic floor and PT work. And she was just like looking at my abdomen, and she was like assessing my intestines and like where everything was aligned. And she was like, hey, like, have you ever had any bladder issues? And I was like, no. I mean, I went through 12 weeks of, pelvic floor PT to be cleared for fitness. And I don't really think like I didn't hit any of those red flags per se, but she was just messing with all along my scar. She said, well, like, you definitely have a bladder prolapse. And I was like, oh, yeah. She was like, you may have like super mild symptoms and it never would have caused you any discomfort. But she said, I'm going to release all of this scar tissue, or at least work on some of this, because your scar isn't moving. And literally, kid you not, within, hours, like my physical appearance of my belly looked different, but I almost felt like I could breathe, like literally all the way up into my lungs. I felt like I could take a deeper breath because I didn't realize my body had compensated by just the tightness along my scar tissue.
Yeah. That's amazing. Yeah. We see that a lot, just kind of with that pulling. And, I've had a lot of moms come in and say, like, I feel like I can't stand up straight. Like, I feel like I can't stand up all the way. And so we work a lot on that scar tissue release and just getting that extension and getting that stretch. And it's one of those things where in the hospital setting, a lot of patients that had, say they had, a bowel resection, for example, say they had a bowel resection.
Okay.
They're getting orders for PT.
Right.
Probably the next day or two while they're in the hospital recovering. They're getting orders for PT. So a physical therapist that's in the hospital is going to come in, make sure that they can get up, make sure that they can get out of bed, make sure that they can walk. Are we doing that for our C-section moms?
Mm-mm.
No.
Or just postpartum in general?
Which is just any mom. No, of course not. No, because it's just like, oh, well, you got it. Okay, bye. And it's just, it drives us crazy. It drives us crazy because it is so needed. And for a lot of moms, especially post-cesarean section, they're like, okay, well, you have a 10-pound lifting restriction. Like, you can't lift more than 10 pounds. And for some moms, it's like, okay, my baby weighed 9.5 pounds. So
that's exactly what happened for us. Yeah.
It's just like, well, you can't lift more than 10 pounds. And so, and my coworker, her cousin, her baby was like 10.5, 11 pounds. Like, it was a big
goodness.
baby. And so like they come in and they're like, okay, you can't lift more than 10 pounds. And she just like looks at them, looks at her baby. She's like, so I can't lift my child? My baby?
Right.
And they were just kind of like, oh, well, like, except for that, and it's just like, okay, well, then what's the point of having the 10-pound lifting restriction? Or like, why is that there? How am I going to accommodate for that? How am I going to say, if that's the restriction, if I shouldn't be lifting more than 10 pounds, but I still have to lift my child, what does that look like?
Exactly.
How do I know that I'm doing it correctly? And so we are starting to see a really big push in the inpatient, in the hospital setting for orders for PT postpartum, and getting these moms up and walking and making sure they know how to brace and, kind of protect that scar as they move and as they lift. And it's just like, okay, technically your lifting restrictions are this. Realistically, let's go over what that's going to look like for you in the next couple of weeks. And so we're really starting to see a really big push just in legislation even. And just there have been new laws that have been passed just for pelvic floor rehab postpartum.
Yeah.
But we're really starting to get that push in like day one after baby is here. And so there was a really big push for that, especially during the pandemic, because some of these moms were having to be separated from their babies like immediately. Like if the mom came in and tested positive, they were immediately separated from that baby. And so a lot of PTs were like, let us go. We will get these moms up and walking. Not only is that going to help their healing process, but like, let's walk them down to the nursery so they can at least see their baby.
Like
let's get that mobility in there for them. And then, the emotional side of everything as well, just being able to actually lay eyes on their baby child that they just gave birth to that they can't even hold. So it's like I said, we're finally starting to catch up to the research and to the actual science behind these things in our legislation and in our medical practice.
Yeah, that's awesome. And it's just so needed because I remember like I would say that I had really prepared myself. Like my husband and I had made it a priority to invest in our pregnancy. Like our biggest thing was the baby will get taken care of. Like our friends and family will support him and he'll be fine. But we have to prioritize myself being healthy through pregnancy and especially postpartum. And I don't think I was ready for, I think, the recovery process of a C-section because I couldn't get out of the car, much less like
Yeah.
my husband had to wash my hair because I couldn't, my whole trunk was traumatized and I couldn't even brush my hair, much less do anything else or brush my teeth. So I think that's just like a really wise point and just kind of exciting to think that like good hospitals are moving in the direction at least towards supporting moms, regardless of whether this is their fifth baby or first baby. But pelvic floor therapy should definitely be a first step in screening process.
Yeah. So we're getting there. We're getting there.
So would you have any wisdom or, I guess, encouragement to share for fitness during pregnancy or postpartum?
Yes, absolutely. And it is, way, way, way back in the day, it used to be considered, is that dangerous for the baby or, pregnant women shouldn't work out. And it's really, research has shown the exact opposite. Like pregnant women need to be working out. They need to be lifting. They need to be exercising. Typically, we don't recommend that you start a new form of exercise during pregnancy.
Right. Like don't start CrossFit if you've never CrossFit before.
Yeah. If you've never done CrossFit before, maybe during pregnancy isn't the time for you. Now, that being said, if that is what your heart is absolutely set on and there is no swaying you, just make sure you're doing it right. Just listen to your body, listen to your coaches, the trainers, all of those things that are kind of going to be there with you during that process. But research has really, really shown the importance of exercise during pregnancy. It's huge. It's absolutely huge. And definitely something that we want to encourage in our pregnant women. So not only does it help with blood flow and circulation, it's actually really, really good for the baby too. It helps with a lot of that fetal circulation. It helps to keep mom at a healthy weight. There's a normal healthy weight gain, usually in the 20 to 30 pound range. Now I've known moms that have gained 60 pounds during pregnancy. So it's a really, really big range. And everybody is so different too. Everybody is so different. So, depending on the size of the baby and the size of the placenta and how much blood flow and how much fluid, like so many different factors go into that. But just kind of maintaining that healthy weight during pregnancy can be really, really huge. And it's, like I said, it's one thing that I'm really glad that has shifted in just kind of the medical research. It's, our pregnant moms definitely need to be exercising. So usually about 20 to 30 minutes of aerobic exercise 5 times a week, somewhere in there is usually kind of that recommendation. So go for a walk, go for a walk with the family, walk the dogs. If you're a runner, you are 100% safe to continue running throughout the pregnancy. Like I've known moms that have like ran 10 miles and then delivered the next day. Like it really is, it is safe. It is healthy. Now, if there are any other sort of complications going on, like maybe preeclampsia or if you're having a lot of pain or discomfort during that exercise, then okay, yes, maybe we want to scale back a little bit, keep you safe, right? Keep mom safe. And if there are any certain, medical considerations or complications that might be foreseen during that pregnancy or during the delivery process, your OBGYN, your midwife might recommend like, all right, cool it. Like no more 10-mile runs for you until this baby gets here. Like let's scale it back a little bit, especially if there are concerns of preeclampsia or bleeding or anything like that. That can be a concern. But for the most part, really, truly, it is so healthy for these women to continue to work out throughout pregnancy. And then moving into postpartum, my biggest thing is just listen to your body. Just listen to your body. Take it at your own pace. Take it at what you feel comfortable with. Because there are, especially our running population, something about runners, they are just so like nitty gritty, like let me get back into it. Let me do this right now. They want to start start very, very quickly. And with running, it's usually kind of more so in the 10 to 12 week range that we really start to see that the more safety to return to running. We definitely want to wait until all bleeding has stopped postpartum before you start any sort of running and exercise process, just to make sure that everything is healing well down there. And that's regardless of C-section or vaginal delivery, amount of tearing, anything like that. We just want to make sure that that bleeding has stopped. And so, and that's where your pelvic floor PT comes in as well. Like, making sure that you're engaging the core properly and using the pelvic floor muscles properly to give you that support, give your pelvic girdle and your abdomen that support that it needs as you start exercising again. So that's probably one of my favorite things to treat is postpartum, like return to exercise, because these moms are just so ready. They're like, when can I work out again? When can I work out again? I'm like, girl, let's do it. Like, let's get going. Let's figure it out. And so it might seem like we're starting with really just almost like rudimentary and kind of, sometimes I feel bad. I'm like, I know this is going to seem really boring, like compared to what you've done before, this is going to feel really boring, but we've got to establish the basis first before we start building into everything else. So again, making sure, that's why you got a pelvic PT, make sure you're breathing properly, pelvic floor is engaged, core is engaged, and doing those functional activities that are meaningful to the mom too. So I have some patients that are, for my runners, I'm not going to make them do like the weight training that my weightlifters want to do and vice versa. And so like making sure that it's, appropriate and functional and meaningful to each individual person.
Yeah. And
what specifically they're trying to get back to is like my favorite thing to kind of troubleshoot, and like, it's like a little puzzle, like solving everything and like putting everything together for them. So it's awesome. It's awesome.
Yes, I can definitely empathize with that and geek out over that, because like I got pre and postnatal certified after the baby just because I was like, no,
nice.
Other women need this and I needed this, and I didn't have anybody else to walk alongside me in that. So I definitely feel your passion in that.
It's so fun.
So circling back to core, because I think this is just a juicy topic for a lot of moms as they process pregnancy and postpartum, is diastasis recti, the separation of your core. It's so sad because sometimes, I see on Pinterest or Instagram and it's like how to keep your core from separating. These are all the 5 exercises you need to do.
If it's going to separate, it's going to separate. It's going to happen. And it almost needs to as well. So it's the rectus abdominis is that layer that separates. So we have the rectus abdominis, that's that 6-pack muscle that we see. And underneath that, we have a layer of external obliques. Underneath that, we have a layer of internal obliques. And then underneath all of that, we have a layer called the transverse abdominis. And so all 4 of those muscles together kind of combine and really kind of make up what we call the core. And so the rectus abdominis is the muscle that separates. And so as that baby grows, that first layer is kind of held together by a layer of tissue called the linea alba. And it's just a piece of connective tissue. It's pretty fibrous. It's pretty thick. But as that baby grows and the belly expands, and it happens pretty quick too. Like this, it's not like it just happens, over a couple years. No, that baby's growing. And so with that separation, with that growth, we see those 2 sides of that rectus abdominis kind of start to separate a little bit. And so with that separation, we can see that's what the diastasis recti is that separation of that rectus abdominis. And so we measure it in finger breadths and finger widths. And so I've seen anywhere from like half a finger postpartum all the way up to 4 fingers. And that's probably the most significant one that I've seen clinically. But I do know some of my other coworkers have seen like 5, 6, 7 plus. And that can change too, depending on how many babies they've had and what their exercise looked like postpartum. But for the most part, we really see these start to heal on their own, which is great, which is fantastic. Especially if it's more on the smaller side, like a 1 finger, half a finger, those really do tend to just heal pretty well on their own, and just some behavioral modifications as well. So we always want to avoid, kind of big twisting movements. So I tell my patients, I'm like, okay, okay, if you're backing up out of the driveway, use your mirrors, use your camera. Don't twist all the way around. If the kids are acting up in the back seat, just like throw things at them from behind your shoulder
Throw some
rather than
snacks.
trying to twist. Exactly. Rather than trying to twist and get to them. And then, with exercise, staying away from some of those rotational exercises like Russian twists or bicycles, things like that. And then kind of just being mindful of any sort of shearing forces through that muscle. So if you're doing leg lifts, keeping both legs together rather than doing like one at a time. And I mean, little things like that. But, and we've really started to see, it's called abdominal gymnastics, I think is what it's called, which is really, really cool. But it's basically using that transverse abdominis as kind of our that pulling factor. So with the transverse abdominis, it acts as the body's natural corset and the body's natural back brace. And so if you look up like abdominal vacuums, you'll see some really weird looking pictures of people that look like they're sucking in as much as they possibly can. It's like all you see is ribs and then like their belly like a foot backwards from it. And so that is basically, with that abdominal vacuum, is basically a maximum contraction of the transverse abdominis. And what that does is it actually helps to approximate those two sides of the rectus abdominis, right? Because we're getting that pulling and kind of that approximation when we contract that deep, deep core muscle. It brings those two sides of the rectus abdominis together, and it can allow them to heal a little bit more quickly. And so we've seen some really good research coming out of utilizing that vacuum in our postpartum population to help assist with that closure. And so, like I said, I mean, if it's going to happen, if those muscles are likely going to separate, even with the forefinger diastasis that I've seen that went down to half a finger in the span of a couple weeks, and she had 11 kids. So
definitely,
it was, it was an easy process for her. Like I said, just those behavioral modifications, adding in some proper core contraction and some approximation, and she was good to go.
Yeah. And it's not something to fear. It's not something to avoid. Like our bodies were made to do it. And so it's not something to, I think, actively prevent, because your body's going to compensate anyways.
Exactly. If it's going to happen, it's going to happen. I mean, I've even seen it in men before too, that, got a little bit too carried away with the beer over, the NFL football season. And, just because that it's the same thing, that quick expansion of the belly, they get that separation. And so, yeah, it can happen to men, but yes, it's very likely to happen in women, but absolutely nothing to be too concerned of. There are surgeries. It's basically a hernia is kind of what it comes down to. It's basically a hernia. And so a lot of women will notice, like, well, when I crunch forward, I see like this bulge, like this
a dome
bulge, kind of the doming. Yeah. And so that is kind of where we see, it's essentially kind of some of the intestines that are just kind of bulging and pushing into that separation. And so if we can, approximate those two sides, they were good to go.
Absolutely. And we might have talked about this a little bit, but as we move towards wrapping up, what encouragement would you give to women about seeking professional treatment?
Don't give up. Don't give up and be an advocate for yourself. Unfortunately, like I said, we are seeing a great push for postpartum and pregnancy care, and even just care for women throughout the lifespan that has really changed. I mean, even over the last 50 years, that has changed significantly, but we've still got a long way to go. And so don't be afraid to push. Don't be afraid to ask and be an advocate for yourself to seek, to get the care that you want and the care that you feel that you deserve. And so, whether that means, like, unfortunately, like you had to do, just pushing for that pelvic floor referral. Like, even if you have to ask and ask and ask and ask and ask, keep asking, keep pushing. And if it's absolutely worth it. And with kind of how physical therapy practice works in the state of Texas, we do need a physician referral in order to see a patient kind of long-term. So we can see direct access, meaning like you call the clinic and be like, hey, I want to get in to see so-and-so, like, I want physical therapy. And this goes for any type of PT. And so they can get in and schedule, but within 10 days, we do need a referral. We do need a script from some sort of physician.
Yeah.
Now, this can come from any physician. This can come from a primary care doctor, a gynecologist, your OBGYN. This can come from a chiropractor. This can come from a dentist. Like, this can really go, there are a lot of different avenues. So, if your gynecologist or your OB B isn't, super stoked about sending you to primary care or sending you to pelvic floor PT, call your primary care doctor, see if they will. There are other options. And even if within that 10 days, if you are not able to get a physician to sign off on anything, we can at least treat during those 10 days. We can at least start. And, even if we're not able to get some of that long-term care, we can at least kind of cover the basics and just kind of, get you comfortable to where you at least start. So yeah, that's my biggest piece of advice, is to just don't be afraid to fight. Don't be afraid to argue. Don't be afraid to, say, no, this is what I want, and I'm not leaving your office until you send me a referral. Like, don't be afraid to do that. Because they'll do it. They'll be like, all right, go, just go. And then if you come back and you're like, it changed my life, this was the easiest postpartum recovery I ever had, this was amazing, send more people.
Absolutely.
Then the next mom is going to be more likely to get that referral a lot easier, and the next one, the next one, and the next one. So even if you got to pave the way in that doctor's office, don't be afraid to do it.
For sure. That's my biggest encouragement to friends that are pregnant and postpartum, is like, go see a pelvic floor therapist, like we've talked about, even just as a checkpoint, definitely can be beneficial throughout your pregnancy, even if you aren't experiencing any symptoms, but just can give you, I think it can just give moms some tangible confidence as they approach birth, which can be super like mentally daunting. And then postpartum, it gives you the tools to say, okay, I may not be able to return to fitness in the next, 6 to 8 weeks, but at least I know I can get out of bed in a safe way that's not going to cause more discomfort. And that sometimes is like the biggest one of the day, is being able to go about your, new baby and like your new body in a way that's a little bit more confident,
Yeah. And pain-free and functional. And, it's not only are you recovering from a trauma, that actual delivery process, not only does your body have to heal, but now you have to care for a whole another human being that is completely dependent on you. And so there's so many things that go into that. So yes, absolutely. Pelvic health can just help to really start to make our moms pre, post, and everywhere in between just feel more comfortable with themselves, with their body, with their functioning.
Absolutely. So I have one more question for you, and it may be the same or different as we close, but it's just a closing question that we have for all of our guests, just because this is a podcast where we want to speak truth over our current selves and past selves and just be a resource for our community. So if you could provide any wisdom to your younger self or a community that is listening, what would you share?
Don't be afraid to be you and get the help that you need. And, just seeing the shift in the medical community and everything, just being an advocate for yourself and being an advocate for your body and what you need is going to help pave the way for the patient after you.
That's so wise. Wow, Rachel, it's been such a pleasure just to catch up.
It's been so much fun. Yeah, thank you so much, so much for having me. It's been awesome.
Of course. So where can our community connect with you? Do you have we're obviously not in your area, but we may have listeners that are. So services, products, how can they connect with you?
Absolutely. So I practice at Optimal Physical Therapy Solutions in Amarillo, Texas. So if you are in the Amarillo Canyon area and want to get in to see me, you can call our office there at Optimal Physical Therapy Solutions. And then my coworker and I, we also have a podcast that is called Pelvic Service Announcement. And you can find us on Instagram, and we talk all things pelvic floor. We release episodes on Tuesdays. We have so much fun, probably a little bit too much fun with it sometimes, but so yeah, we're on Instagram. We are also on Apple Podcasts, Spotify, Google Podcasts, pretty much anywhere you can find podcasts. We are on those platforms. And then my personal Instagram is just Rachel K. Fritz. You can find me there. Shoot me a DM or anything like that if you have any questions, and we'll go from there.
Sweet. And I'll link all those below. But guys, their podcast is so fun. I think your names are so clever. I was even sharing with a friend yesterday, and I was like, yeah, it's pelvic service now. And she was like, that's so funny.
Well, we were trying to think of names for it, and I was just kind of looking to see if there were any other pelvic floor podcasts out there, and there were a few, and one of them was At Your Cervix, and I was like, that's hilarious. Like, that is so punny. And I was like, we need something like that that's like really catchy. And so my mom, bless her heart, for whatever reason, she always calls it the public floor. I don't know why. I think there was a class that I took where we had to do internal exams like every 5 minutes. It was like we were switching partners. So like nobody had pants on, nobody was doing anything. And she's like, that's so public, like your public floor kind of thing. And I was like kind of thinking about it, and I was like, public floor, pelvic service announcement. So it just kind of came up. So I credit my mom in helping us come up with that name. So
yeah, that's such a fun story. How sweet. But as we close, I did say I wanted to circle back to bodybuilding. So what is next for you? Kind of what's your plan moving forward?
Yeah, so I've competed for 3 years now. I've done 5 shows, and this season was definitely my most successul season. So I won first place in both of the shows that I did.
That's awesome.
And in first place in my height class, and then in one of the shows I won the overall. So between all the height classes, I won the whole thing, and it was a goal that I had set for myself for a really long time was to win the overall. So that was just so special. But moving forward, definitely looking at maybe a chance to go for my pro card next year. And so just kind of right now spending the off season just really focusing on putting on some solid muscle tissue, some solid muscle mass, and I'm so stoked. Like, I'm so ready for next year. So it's so much fun, and I think that it's given me a good practice as a physical therapist too, because I'm just like, okay, how can I preach to my patients to live a healthy lifestyle if I'm not doing the same? If I'm not being a good patient myself. So it's definitely helped in that aspect too. So it's so much fun. It is such a fun hobby, such a fun pastime, and I love it so much.
Yeah, you look great.
Thank you.
It's just so fun to watch you from afar. But this has been such a pleasure to have this conversation with you. We may definitely have to circle back for a second part because this is just such a fun conversation.
Of course. Thank you for having me.
Thank you so much for joining us, and we'll catch you guys soon on the next episode. This episode of If Only I Were Wiser has ended, but be sure to subscribe for more episodes so you don't miss any encouragement. And don't forget to rate and review so we can continue to build our community and share more about topics that will be healing and helpful for you. See you in the next episode.